Welcome to Perspectives with Asima Silva. We're taping today at WCCA TV, and as usual, I'm always looking for great, interesting stories and guests to bring to you. And I had the privilege of being at an iftar dinner at Worcester Islamic Center, and lo and behold, I had these two wonderful gentlemen sit on my table, and we got it started talking. And I know most of my shows have kind of started off in that manner, where I coincidentally meet these really interesting people and I invite them on my show. So today, I do like to introduce my guests. Very interesting show that has to do with a lot of healthcare, free clinic, with Afghan refugees. And today we have Drew Romasco. He's a clinic coordinator for Worcester Islamic Center. We have Fahim Choudhury, who's a co-president, along with Kayla Loycano, who's also a co-president for the Worcester Free Care Collaborative. And what we want to discuss today is their work. And I thought it was amazing that the young people are volunteering their time to give free care to the people of Worcester. Specifically, what I'm interested in talking about today is the Afghan refugees who have moved into the Worcester County. So I'd like to turn it over to all three of you. If you'd like to introduce yourselves a little bit more than just your titles, please do so that our listeners can get to know you a little bit better.
Sure, I can start. So thank you so much for having us, Asima. My name is Andrew. A lot of my friends do call me Drew, and I'm a medical student, a first-year medical student at UMass Medical. I grew up in Massachusetts. I went to UMass Amherst for undergrad, and now I'm here at UMass Med, and it's been an utter privilege and joy to work with all the Afghan refugees and everyone at the WICS Clinic.
That's great.
So like I said, my name is Kayla Loycano. I also went to school at a UMass system. I went to school at UMass Dartmouth, graduated in 2019, and now I'm here at UMass Medical School as a first-year student. I don't work directly with just the Afghan refugees. I work kind of across the whole Worcester Free Care Collaborative, WFCC, all together. So I see a lot of different kinds of patients, but it has been a privilege to work with all of them throughout the whole experience.
And I'm Fahim. I'm also one of the co-presidents of the WFCC, and I also work throughout all the clinics, and really my role is to try and integrate them all, make sure that people are going, we can direct people to get the best care that they can receive. And yeah, with this Afghan refugee crisis, it's been really impactful for us to make sure that our clinics are being well integrated and we can give back to the population. It's been fantastic.
So I apologize for my basic questions. We are Worcester. We have plenty of hospitals and clinics in our county. Why do we need so much free clinics and healthcare? And who's coming to these free clinics and healthcare?
Yeah, that's a fantastic question. One I really wanted to touch on. I was about to say it in my intro, but I think one thing we really talk about often is in a perfect world, these free clinics would not exist. Everyone should have access to go to a hospital and see a doctor who's been properly trained. And we are there as kind of a stepping stone, and our end goal here is to try and get the patients, the care that they need just temporarily until they can go to a hospital. And so for that, we have case management team set up, which is a new thing we started this year to try and get people insured, get people the information, contact information, resources to go and see greater care and have care that can be sustainable. And, we're only first year. We'll be in med school for 4 years, and then there's a complete rotation. So it's nice to have a primary care physician, and that's something we really aim to do. And I think, I know Drew's been seeing a lot of the refugees. You may be able to speak more to that too.
Yeah, absolutely. And I just want to build on that and say that it's absolutely true that we do see Afghan refugees at our WICS clinic, but it actually didn't start that way. We began working at the mosque in Worcester and just seeing the patients there who might have needed care. And even while we're at the location we are now, which is a hotel in Worcester with all the Afghan refugees, we still do see patients who aren't Afghan refugees. And that's totally fine too. There are so many people in communities in Worcester who need just a little bit more help. And we are so glad and privileged to be able to help give that for them.
So what kind of issues do you see at the free clinic?
Everything. A lot of people will come in need of seeing a doctor for the first time in a really long time. So for example, in the refugee population, they'll come in, they are new to the country, they just need to see someone because they don't have anywhere else to go. So they come for medical advice, they come for general physicals, or if they have an ailment or a pain that's hurting them right now in real time, they'll come for that too.
When you guys obviously are seeing these population and you're trying to be part of the solution, as a general question in terms of our state and our economy, how do you see this fit in? Is this always a bandaid that you think is going to continue happening, or is this just a stepping stone to an actual solution?
That's a fantastic question, and that's really something we honestly grapple with every year, and at every one of our meetings. That's kind of the main talking point: is what is the end solution here? And I think, we are a band-aid solution. Whether or not that's going to be necessary in our lifetimes, we would love to say hopefully not, and hopefully our generation of physicians can, advocate for these patient populations that aren't getting people to advocate for them. And I think that's kind of our end goal in this. What we do throughout the year is to just try and help out these patients as the most we can. So I think that means as first-year med students to get their information, to try and help out the doctors that are also volunteering their time. And hopefully that means as physicians that we can go to the government and make actual policy changes that will help these populations.
So before I get into further questions about the clinic, I'm a little curious on, you guys are in med school, and so I'm sure your lives are busy. Where are you finding the time, and why are you doing this?
I think all of us make the time, to be quite honest. Yes, classes are incredibly time-consuming and difficult, and the rigor is great, but at the same time, it's great to be able to work with patients and be reminded about why we decided to do this in the first place. Why did we decide to be physicians? It wasn't to study all day in a library, right? It was to meet people and to help people and to learn more about the different communities that we can possibly work with. And so it's an utter joy to go to WICS and other clinics to do just that. And so, yes, it is an add-on of time and energy, but I always feel like after I finish the shift, and I'm sure each of you do as well, that it really gives me purpose, and it helps to put in context the things that we're learning to real patients and faces that I feel only make us better physicians.
So would you like to answer that question?
I think Drew pretty much hit the nail on the head. Something that a lot of people may not realize about medical school is that the first 2 years, we get a little bit of taste of clinical stuff, but it's really a lot of studying. And we spend a lot of time by ourselves, stuck up in a library, in our rooms, just learning all of the baseline material that we need in order to grow as a clinical physician. But going into these clinics, you have the opportunity to remind yourself of why you're here, and the population that you can help as you grow in this career is really, really impactful.
Yeah, I fully agree with two of those, and I just want to add one more thing, which is the three of us are here, but there's a whole team behind us. There's tons of people on the board, tons of physicians who are giving their time, who are even more busy than we are, tons of even non-clinical healthcare workers giving their time, and anyone. We appreciate all the help we get, and it really couldn't be done without the entire city of Worcester really coming behind us.
So I'm going to go back to something you said. You said you have been exposed to a lot of different communities that require help in healthcare. Can you educate us of what those communities are? Who are they? And anything that surprised you where you wouldn't have thought that, hey, this community would have been somebody in need?
They're everybody. Everybody needs a little bit of help at any time. They're old people, they're younger people, they are people who go to our churches, they're people who don't go to our churches, they're people who you'll see shopping for groceries, they're people who you might see using their SNAP cards for BET benefits. Anyone and everybody needs healthcare, and at our free clinics we give everyone and anyone free healthcare. And so I think maybe a good story of that is it's not just people who live in Worcester who can access this care. I also had a patient a couple of weeks ago who was from London and who just happened to be in Worcester visiting a family member, and they needed to be seen because they thought they were having a UTI. And so they came to our clinic, and we were able to help reference them and give them some care and advice. And so really it is absolutely anybody who needs help can come to these clinics.
So when they come to your clinic, are they expecting to get a prescription or just advice, or do you have basic medicine on hand that you hand out? What's to be expected?
So there are many different clinics, and perhaps my friends here can talk more about the capabilities of those clinics. But I know for at least at WICS, a lot of what we can provide is not everything we'd love to, right? We don't have ultrasound machines. We can't take your x-ray and our MRI. We can't do procedures, and even the medications that we have are rather limited.
Right.
And so a lot of our medications are just over-the-counter medications that we've bought and can give to them for free. Or advice that a physician might be able to provide, sit a certain way, or don't do this or do that.
Right.
We are extremely limited, and that kind of goes back to our conversation about band-aids, right? We're a band-aid, and we're doing the absolute best that we can, and we have an amazing team who I would love to give the names of everyone on our team later if possible, but we just can't provide the services that a hospital can. At least at WICS, that's what we can provide.
Yeah, I can. So I can say all the clinics are limited. They're not hospitals, and we do talk about why we're a band-aid, and we think We have had the privilege of having a lot of specialty physicians start to volunteer their time also, which has been tremendously helpful. And that's one of our biggest goals of this year, is to try and, if patients come in with a specific, like let's say they do need a cardiologist, they need to get an echo, we have clinics where that can happen. And so our goal is to try and focus those people to go to those clinics. And so we'll plug this throughout, I think, but our website, worcesterfreecare.org, that's the best place to go, and you can see every single clinic listed there and the services they offer. So what you were saying, some of us, we have over-the-counter medication, they can do prescription refills, tweak your prescription a little bit. We also have vaccines, which are relatively new, and that's something we highly recommend taking advantage of, because, we have walk-in vaccine care, we can do cardiograms, so really it's a whole broad spectrum of things. And we would say, at least we hope that even if we can't provide the service directly, we have a whole case management team, another team dedicated to the idea of getting you the right resources, so we can at least guide you in the correct direction.
So any interesting stories you would like to our viewers to know about where you really helped someone in a way that you did not imagine doing the work that you're doing right now?
When you say that, I'm just immediately thinking of so many people that I've met. And I feel like the best way for me to tell this story is to kind of start by saying like the ways that the people on my team have helped, and then the ways that I've been able to like just be there and be present for some of them. And so, for example, yesterday I was at the Free Clare Clinic with Kayla, and when we were there, we met a patient who was having difficulty with her leg. And so she was having pain in her leg, and we didn't quite know what was going on. So we began by asking questions. And her husband was there, so her husband could help translate, because at Wicks Clinic, one of the things that we have is our patients speak a vast variety of languages: Urdu, Pashto, Arabic, anything and everything you can think of.
Right.
And so we began by asking questions about when she started to feel the pain, what happened. Kayla was able to come and help actually perform the physical exam for this patient. And then we were able to have her see our physician, Dr. Redwan, who was present. And he was fantastic. He was able to give her a medication to help with her pain, so both like a topical cream to help, as well as some pain medication that she can take orally. And then he was also able to help refer her to a primary care physician, because at this point, she was an Afghan refugee. She didn't have a primary care physician to see to help navigate this complex U.S. healthcare system. And so we could help assign her and give her a primary care physician to do the work that maybe we couldn't do in the 20, 30 minutes that we had together. And that was just really lovely to see, because now I know that she can be passed into the hands of someone else who can continue taking great care of her while we were able to provide this immediate pain relief for her. So that was really lovely to see. And that was just yesterday.
Yeah.
Yeah, I would say I think my most touching story was not even seeing a patient, but in the same, in the Wicks Clinic, we have these Afghan refugees living in the hotels. And because of that, there are a lot of these children that are running around in the lobbies. And for them, I think it's a lot of fun. You have people over. It's like a little party instead of this clinic that's going on. And so, they're in the lobby while the clinic is in a separate place. But I think on the way out, when I first went there, I spent a lot of time with the kids at the end. I think that was, for me, really eye-opening, seeing that it really is families uplifted. I think even sometimes when you see the patient, you see him as an individual, but there's, every single person has a story behind them, and every single person has this tremendous spider web of relationships that every person affects. And so for me, at the end, like playing with these kids, there's this one who really, he loves to arm wrestle. He's like, come arm wrestle me, and it's the best thing. Every time you go, you have a little arm wrestle with him. So I think it's really recognizing how patients themselves are very complex people, have complex relationships. That's really the benefit that these clinics provide for me. Kayla.
Yeah, absolutely. I would say one of my most memorable patients was something that was actually kind of straightforward. He was a young gentleman that wanted to come and get a physical exam for his basketball team. He was joining a new basketball team. And it was just something about like the whole interaction of going through it with him and practicing my skills, and him interested in my story and me interested in his story, and like the camaraderie of student athletes, I guess. That was just so humbling to me. And also the fact that, as a side note, he had insurance, but he wasn't able to get an appointment with a regular clinic. Like, he had to come to us, and we were able to be there for him and get it done so he could go play his sport. I think that was just really rewarding for me.
So going off on what you just said, how do people come in? Do they make an appointment, or it's walk-in?
It depends on the clinic. All the clinics will accept walk-ins. Some clinics have a much bigger patient population than others, so they prefer that you make an appointment beforehand, and that's just calling a telephone number.
Okay. Do you guys see yourself working at these clinics after you've graduated and your life has become even more busier?
Absolutely.
Absolutely.
Yes.
Yeah. I think it takes a tremendous amount of work for a physician to even start one of these clinics. So I think we're very grateful that someone has taken the work to do that. Like these clinics couldn't run without these physicians donating time. As much as we really want to do, we need a physician there. And so I'll also say this is a call to all physicians who would love to help. We would love to have your help. And even past that, I hope at one point we can be these physicians who are running these clinics wherever we are throughout the world.
So how many physicians do you have volunteering for you, and what gaps are there in terms of skills, and what gaps do you have plenty of?
I'll start with saying I don't know if we have plenty of anything. We would always love more help. Time is very valuable, and it's a resource that you really have to invest properly. But in terms of gaps, I think specialty physicians are a little harder to come by, and I think part of it is specialty physicians are in need everywhere. So hospitals are also needing them, and as a result, it's hard to give your time to these local volunteer organizations. But I think even then, again, like I would say our main purpose is even if you come in needing to see a specialty physician, we'd still love to see you and help you in the way we can, and then hopefully direct you to a physician who does have time to see you, and that's really our end goal.
Sounds good. Is there any other things, because we have plenty of time, and I know I'm a novice at this. Like I'm just right now trying to absorb everything you guys have said in terms of time, in terms of healthcare, in terms of everyone's different cultures and the challenges that you are facing. So what is the other things you would like our viewers to know about with all the work that you're doing?
I know I mentioned it earlier, but I really want to get this in while I can, and that is all of the help that we get from so many different people. I mean, I'm here as just one clinic coordinator for WICS, but I have an amazing group of friends and other staff who can help out. And so that includes Sumaya, that includes Michael, that includes Levi, that includes Zaheen, and those are all just the clinic coordinators and PCCs for WICS. But even then within the clinic, we also have Dr. Ramzan, who has been incredibly helpful with these patients. We have Dr. Redwan, who I already mentioned. We have so many more doctors who I can't even name all their names. We have the Afghan refugees themselves who have been intricately helpful in translating for us. And so develop really cool relationships with them and just meet many people that way. We have students from MCPHS who are helping us sign up patients for eye exams. So last night I was giving patients a call and we were signing people up to go get their glasses checked. People need prescriptions for glasses. Right. That's something you might not think of, but it's been great to be able to give them the opportunity to do that through these other students. We just have people from all over Worcester coming together to help out these patients and populations, and I just can't be grateful enough for everything that they do.
Yeah, outside of WICS, I would say some other groups that we have working in the clinics that we'd like to give a shout out to are the nurses. Our nurses and our nursing students that help out with vaccinations and taking blood and things like that. It's invaluable to these patients, especially because if we're able to give vaccines, if we're able to do labs at our clinics, we don't have to send these people out, 3, 4, 5 weeks later before they can do it at another place when their insurance works or when we can find some other place to do it. So it's absolutely invaluable to have those groups as well. And on top of that, just regular community members, people that heard about this, they heard about the cause, they want to make a difference, they sign up too. They help check patients in, they help mitigate patient flow and things like that. So it's just translators, yes. Like as Drew mentioned, we have a lot of patients that speak a lot of different languages, and especially at clinics such as St. Anne's and St. Peter's, we have a huge Portuguese-speaking population, Spanish-speaking population. So the students and the other community members that come out and just help with translating is invaluable to us.
Absolutely, yeah, and I think, I was also going to say, Drew's speaking about one clinic specifically, and we have 5 others like that, so you can just imagine the amount of people that go into this, and of course, we would love any support we can get from everyone. We're always happy to take emails, calls, and again, our website, worcesterfreecare.org, you can see where to go, how to volunteer, and those are all things that really, it's really the small things I'll add up to make this.
I'm going to ask you guys a couple of hard questions. So how do you feel, or the response that you would have to someone saying, well, these are the reasons why refugees are a burden on our economy and in our country, because we don't have these resources. And the resources that we have, as you have said before, our doctors are busy, even our hospitals are lacking specialists. And now you're asking them to volunteer time for people that, we need to take care of our own citizens before we can take care of others. How would you respond to that?
I would start off by saying that's extremely short-sighted, we're talking about the Afghan refugees because that's one of our most recent populations that has come to us, but these clinics lasted long before that. And without any sort of immigrant population, these clinics would still be filled to the brim because there's such a deep-rooted systemic issue in the American healthcare system. So I would say to that person, maybe do your research and come back and talk to me.
Yeah, no, I agree with that sentiment. I think like these clinics have started long before any refugees have come in, and they're going to continue really forever until there can be systematic political changes. And I think selfishly, I'd also like to add that I think these clinics are beneficial for us as much as we're benefiting the patient population. It creates the next generation of doctors to be really a lot better prepared and a lot better integrated within the community if you are seeing patients every week, if you are seeing patients every day. And as much as, and I think that's part of the reason why we want these patients to be going into real hospitals and seeing actual, trained doctors, because we're still in training, we're still learning. And so it's great for our learning, but at the same time, it's not, obviously the patients would be better suited with doctors. And I also want to say there are physicians there who are really doing all of the care. I don't want to, say in any way that you're getting ill care by going into these clinics. But it's great practice for us selfishly, but also, these clinics have a need and they always will.
And let's not lose sight of the fact that these patient populations are also giving back to Worcester in incredible ways. I remember when I first came, everyone was just getting situated. We were trying to set up everything that was going on, and very quickly, a lot of our Afghan refugees started working in Worcester. And so there's one man in particular who I'm very good friends with who works on the 5th floor of the UMass Research Building, and he's a janitor. And so he's been working as a janitor that whole time. And there's another man who I helped call for last night to get his bank statement set up. He's working right now. He's working nights while also going to school in the morning, while also having to volunteer and set up the clinic for WICS in the evenings and translating. And so these people are working incredibly hard to give back to Worcester. I think if you ask them, they'd say they're incredibly glad to be here and incredibly appreciative to be here. And they've been doing an amazing job getting work and helping and being a part of our community. These are not some separate stock population of people who just aren't talking or integrating with anyone. Yeah. They're wonderful. They're working in the jobs. They'll be at your grocery store. Like I mentioned, they might be your janitor. They might be a professor. These are people who are very much in our communities. And I think it benefits all of us to help lift up the members of our communities so our community can just be better overall.
So kind of the similar question, but I've heard of this where people have said, some of these refugee populations, they're not very healthy or they're not as educated. So the other coin of what I'm asking is, I asked you about our resources drowning, but now the other coin that I'm asking is, how are they, and you answered this a little bit, but contributing back? Because a lot of impression of refugees are they're unhealthy because of the war situations they're coming from conditions that they're coming from, and maybe they're uneducated. So how are they really giving back to our communities?
Allow me to give 3 examples really quickly. So these are 3 examples of 3 people that I've met, 3 lovely people. I'll start with one who helped to translate in clinic, and so I got to know him very well. He is brilliant. In Afghanistan, he worked as an engineer to help build airplanes. I don't know how an airplane works personally, but this man went to school for a very long time to learn just that. And he knows how to speak Urdu fluently, he speaks Pashto fluently, and he speaks English fluently. He has been integrally helpful during our clinics, and he's been wonderful. And I'd also like to talk about his roommate, because now he's in an apartment in Worcester. His roommate is the same age as me and all of us, I imagine. He's about 23 years old. And he went to Kabul University. And now he's here. And when I was talking to him and I was asking him, before I could really even finish the question, how'd you like school? He was saying, oh my God, I loved it. It was so amazing. It was brilliant. I would love to go to school here if I possibly can. And that was really emotionally impactful for me, because I could see myself in him very much. He's the same age as me. I have a distinct love for learning too. Yep. But the thing that separates us is that I've been able to live a very privileged, stable life in the United States with an amazing family. And he had to be moved from his home and replanted here. Yeah. And the third story that I have is of a nurse, actually. And so one of our patients that we saw at the clinics was a nurse in Afghanistan. And so it was funny because she knew what we were going to do before we even did it. She knew the process, and she knew the medications that she needed too. And so these people are incredibly well educated. They're just from a different part of the world. And they're here now, and we can benefit from the amazing skills that they have.
Yeah, I agree. I think in particular that second story of, there are kids there like our age who we can see reflected in ourselves. And one thing I have to think about is, I read this, that the only difference between a refugee and you is luck. And like really at the end of the day, we're just very lucky and grateful to be living here and very privileged to be living here. And that's something we really take into account every day.
Would you like to add something, Kayla? Because I know this, I could see it was affecting you as they were talking about some of these situations.
For me, it just really comes down to a humanity issue where it's like we are trying so hard to treat people like treat people, and not everybody in this country does that, and it really frustrates me because that's part of healthcare. Like we are here because these people are coming from a country that maybe didn't treat them like people, maybe didn't give them all the resources that we have here. So the fact that we're using the resources on them doesn't sound like it's wasting it to me. It sounds like it's giving them a chance to actually live a life that we are able to live here. And that's what I want to do with those resources. I can't think of a better place to put them. So that's my 2 cents on it.
So we only have a couple minutes left. I wanted to give the floor to you at this point, all three of you, to talk to the viewers and to talk about what it is that I didn't cover and what it is that I know there was a couple of messages that you wanted to make sure you included, and if there was anything else that you would like to say.
Yeah, I'll start with, I'll say thank you first for having us on here. I think it's been fantastic. We appreciate all the help that we've been getting. We would love even more help, and I think we're really grateful to be even in this role. And as Drew said, I think it's really grounding to be in this role and being able to give to the patient population of Worcester, and being able to get integrated within the community. So I don't know if I introduced it at the beginning, but I'm from out of state, and as a result, I think a big reason why I chose to come to UMass Medical is because UMass Chan Medical School is, so therefore I could see these free clinics and I could integrate with the patients, I could get to know their story, and that's something to me that's really intimately valuable. We are physicians in order to care for the patients, and we signed up to be physicians not to study but to really get to know the patients, and I think this free clinic is a wonderful way to really get to that and really hopefully become better physicians for the future.
Yeah, absolutely. I would just like to give one short shout out to our faculty advisor, Dr. Ludwith. He's been absolutely incredible in integrating all of us into this system and really prolonging the system's flourishment, making sure that the clinics run smoothly and helping us in every step of the way.
Absolutely. It's been a wonderful experience. I can't wait for all the more things we're going to do together. And again, we're just three people who are representing many, many more. And it's been a lovely time. And if anyone has questions or if they want to come to the clinic themselves, they're more than welcome. And we would love to see them.
Great. That leaves us for me to wrap up. As you know, I'm always looking for this show. It's not only giving people a voice, but it's also going over stories that are inspirational, educational, and motivational. So I love this show because I think it includes all of that. And I am so excited that these young people are looking at healthcare not only in terms of just the number of people they take care of, but the number of people, and not just numbers that go through the system. And I think that's what's missing in our healthcare, and that's what I took out of this particular interview today. So call out to all those doctors and community members that want to help out. They need volunteers, and let's help our local community. What was it again?
WorcesterFreeCare.org.
WorcesterFreeCare.org. Thank you again for joining us on Perspectives with Asima Silva.